What are the most common irrational beliefs? Have you ever caught yourself thinking something that just doesn't seem right? In cognitive therapy, these thoughts are known as irrational beliefs. They can lead to negative feelings and behaviors. Let's take a closer look at some of the most common irrational beliefs and how they fit into cognitive behavioral therapy concepts. Irrational beliefs often involve absolute thinking. This means using words like must, should, or ought to. Such thinking can create feelings of anxiety, anger, or sadness. One common type of irrational belief is demandingness. This is when someone believes they must achieve certain outcomes to feel worthy. For example, saying, "I must succeed in my career to be worthy," puts a lot of pressure on oneself. Another common irrational belief is catastrophizing. This is when someone thinks that if things do not go as planned, it will be a disaster. For instance, believing, "If I fail this exam, my life will be ruined," can lead to overwhelming stress. Low frustration tolerance is also a frequent irrational belief. This occurs when someone believes they cannot handle difficult situations. An example would be saying, "I cannot handle this stress, it is unbearable." This kind of thinking can make challenges seem impossible to overcome. Self-deprecation is another irrational belief. This is when someone thinks they are a failure or unworthy if they make mistakes. For example, saying, "I am a total failure because I made a mistake," can be very damaging to one's self-esteem. In cognitive therapy, particularly through cognitive behavioral therapy and rational emotive behavior therapy, these irrational beliefs are addressed. The first step is identifying automatic thoughts. These are the negative thoughts that pop up in response to situations. Next comes reality testing. This involves examining the evidence for these thoughts to see if they hold any truth. After that, cognitive restructuring takes place. This is where irrational beliefs are replaced with more balanced and rational thoughts. Finally, developing emotional regulation skills is essential. This means learning to manage emotions more effectively by adopting healthier thought patterns. For instance, if someone believes, "I must always be perfect," they can challenge this by realizing that perfection is unrealistic. Making mistakes is a natural part of learning. By identifying and challenging these irrational beliefs, individuals can develop more flexible thinking. This leads to better emotional well-being and resilience. Understanding these common irrational beliefs is an important step in improving mental health through cognitive therapy.